The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Welcome. We are here for the next episode of TMD Demystified, and I am Tony Urbanek. Today's topic is entitled TMD Patients Who Don't Want to Get Better. Now, you may say that's an interesting topic, and I have a lot to say about this. It's an accumulation of experience I have had over the past 12 years, and I can easily say estimate of doing over easily 5,000 consultations, most of them over the past 7 years, for TMD patients with TMD symptoms who end up using an Urbanek device and protocol. But there are, and we're going to talk about this in detail, and I'm looking forward to discussing this and putting it into terms that you can understand. There are patients who actually do not want to get better, although they have TMD symptoms that are ruining their lives. And we're going to discuss 5 separate categories, and I don't want to belabor it, but I want to unpack it. I want to expand on it sufficiently so that it becomes real to you, because these 5 categories did not become real to me all at once, and it really was a compilation of years and years of experiencing, talking to people, patients who got the device or didn't get the device, but the reasons, what was going on, and that would fit in the category they really didn't want to get better or go through the steps necessary to get better. So I have 5 categories that we're going to be talking about, and then one special category at the end. And what I have to discuss here, maybe some of you may find odd or hopefully not confusing. I want to make it clear, but some of you may say, well, that's unbelievable. Well, no, what I'm about ready to discuss comes directly from my experience dealing with patients, thousands of patients who have these symptoms. And for whatever reasons, these confusions arise. So let's just kind of dig into this and quit beating around the bush. First of all, those are the ones that you probably at least aware of. If you're not a medical doctor, you probably haven't not experienced anyone who actually has Munchausen syndrome. You can look it up. Munchausen syndrome is basically defined as a patient who gets secondary benefit by keeping sick, by having the problem, by having the symptoms. They don't want to let go of the symptoms. Basically, it's a psychiatric, psychologic problem. There's also Munchausen's by proxy, where the mother will bring a child in and keep complaining of symptoms, basically made up symptoms on the child, that the mother gets secondary benefit of some kind or another by having a sick child. And I don't want to go too deeply into this. It's a psychiatric problem. You can Google it and read up on it. Poorly understood. There are theories about why mothers do that to their children. There are theories about why people do that to themselves. But you may even know someone who likes to dramatize their illness, and that's not Munchausen's. That's a little drama. And children dramatize all the time. Adults dramatize. That's dramatization of an illness. That's not Munchausen's. Munchausen's is actually when they try to do damage to themselves or make themselves sick, or do things that create symptoms and to themselves or their children so that they get secondary psychologic benefits from it. But in any case, that is well known, not really well understood psychiatric problem. But I have seen that occur, which I believe my evaluation is that's what I'm looking at here. I'm looking at a patient that you put into the device, you go through the consultation, you put in the device, you take them through the process, and you don't get the response. You do not get the usual response that you would expect. And we know what the numbers are. We know what the expected responses are. And, patients will, try to describe things that, well, even aren't possible. They'll talk about, one of them that comes to mind is how the device itself causes bleeding in the soft palate area. Well, it doesn't even touch the soft palate area. It doesn't even go back that far. So I would classify that as, a Munchausen problem. And as we're dealing with patients across the board. Certain percent of the patients have psychiatric problems. Fortunately, it's not the majority of people, but there are enough of them where you need to be aware of it. Second category, which is very easy to see, and you will see this category if you do any number of TMD non-surgical treatment with the Urbanek device or any other device. You're going to see this. Adolescent females who do not want to wear the device because of peer pressure. I've seen a boatload of these young females, usually between age 14 and 16. They really have the symptoms. Mom brings them in and they are desperate. Terrible headaches, terrible earaches, keeping them up all night. Mom says, you have to do something. You have to do something. Now, the majority of young females in this category jump at the chance of getting rid of the symptoms, no doubt about it, the vast majority. But there's a much smaller minority who you tell mom, well, this is going to fix it. You have to go through the protocol. You have to keep it in 24/7 for 2 months. And I'll discuss that a little in detail a little bit more. I have discussed that in adolescence. You do treat an adolescent a little more carefully than you treat an adult with this device. But the point is, it started out, well, the first time I saw this many years ago, okay, mom says, all right, get your impressions and let's start. And the patient then gets the device, delivered device, comes back in 3 weeks and no better. And you say, Janie, I said, have you been wearing the device? No, I can't wear the device. Well, don't you want to get better? Well, I won't wear the device. Oh, Janie, why won't you wear the device? He said, I look funny. It's the same thing and why some children do not want to go through orthodontic treatment or you put anything else in their mouth. They get peer pressure. Their girlfriends don't have to wear a device and they make fun of them. But this is a category that you will see. Now, let me unpack this a little bit because I learned is how do you deal with this then? Because you as the provider, you as the doctor, you want to see your patients get better. You want to, be the quote hero, if that's what you want, in front of the mother and make sure that you do the proper thing and get the result. But Janie's not going to wear the device, even though it hurts. So number one, I always make a few comments in front of the mother with the child at that point where we're not making any headway, and it's because the child won't wear the device. I say, first of all, I look at mom and I look at Janie, and I say, Janie, I understand you don't want to wear the device. Okay, what I want you to do is I don't want you to complain to your mom at all. And I'll look at mom, I'll eyeball mom, and I won't say anything more than that. But I say, do not complain to your mom anymore about your headaches or your earaches if you won't do what's necessary to make it go away. And that actually works sometimes. And the child will calm down a little bit. And it's kind of, I don't get in the middle of mom-daughter stuff, but, mom glares at daughter and daughter glares at mom, and I stay out of the middle. But I make sure that they are aware, both of them are aware that, relieves the pressure for mom. It's not okay for her to keep complaining if she won't do what is asked of her to actually get rid of the symptoms. And it is fairly common. The first time it happened, it was a dad who brought the adolescent girl in, and he came back. He was kind of livid because I said, we're going to make her pain go away. And I meant it. I knew it. And if the child had worn the device, pain would have gone away. So, in this particular case, which goes back years and years, one of the first cases that I ran across on this, I just made it clear to the dad, it's like, I cannot force your daughter to wear a device that we know is going to help her. That's kind of, your operation. And it's very disappointing for me. It was always very disappointing. And it's happened. I guess it's probably happened 6 or 8 times over a period of about 10 years, where ultimately the young lady just refuses to wear the device, and we send them out, without help, without success. When that happens, don't take it personally. It's not your fault. It's just they're one of the categories, and we see it, and you will see it when mom brings daughter in or dad brings daughter in. Under the category of TMD patients who do not want to get better. The pain doesn't overcome, in the case of the female, the pain doesn't overcome her need or her anxiety about looking a little different because she's got something between her front teeth. Next category, I've seen a few times. Again, we're talking about 5,000 consultations in patients over a period of 10 years. And I can say I've probably seen this at most 3 times. One was recently, one was in the past year or so. Actually, 2 were in the past 2 or 3 years. Maybe I'm more alert to it now. Maybe I see it more now, but I can only recall at least 3 times where I've seen it at all. And that is patients who cannot tolerate anything in their mouth. And again, I think this comes back to a psychosocial problem. 2 of the 3 patients that fall into this category that I have seen in my practice were of foreign transplants. And actually 2 of them, all of them were female, both of them were female, and they were from the Middle East. But there were 3 particular cases that I can recall where patients, they could not tolerate anything in their mouth. It wasn't that it hurt. It wasn't that it caused any kind of occlusal problems. I couldn't bring out any complaint about that other than I just can't stand it in my mouth. I can't elaborate any more about why that might be, other than it might be something to do, at least because I saw it twice in similar cultures, might have something to do with the culture, may have, which I suspect, but I can't prove, may just be serendipitous, but some people have issues with things in their mouth. I guess maybe that's why some people just won't brush their teeth. I can't expand on that, but I bet somebody did a study on that somewhere along the line, a dental study of the number of people that won't brush their teeth because they can't put anything in their mouth. Next category, what I call the no-betters. I take, my associate takes, and our network providers take, I'm sure, considerable time explaining to the patient why this device works, how it works, the technical knowledge behind it, the anatomy, physiology. I want to make sure the patient understands why it works. You just don't slap something in somebody's mouth like a night guard, we've talked about that infinitum. slap a night guard in, say, here's your treatment, and the patient has no idea what it's doing, what it's supposed to do, what the theory behind it is. Well, that's not fair. So our network providers, and we teach and we do ourselves in a consultation, extensive education as to how this device works, why it works, takes the load off the temporomandibular joint, removes the inflammation in the joint. The inflammation causes all the symptoms. These are the symptoms that are caused directly from inflammation. You separate the back teeth, you take 90% of the loads off, and that is why all the symptoms go away. You tell the patient, well, you're going to need to start out with the protocol. It's very important. You have to keep it in 24/7. Why? Because you have to it takes a while for the inflammation to come down, and you have to do it aggressively at first. But there are a category of patients that I call no-betters, and they want to use it any way they want to. No matter how many times you say it's really important to start out 24/7. If you really want to get the result, and these are the results that you can expect. Within the first week or two, you will start to see significant decrease in your painful symptoms. And we say that because we mean it, because that's what we see if the patient is cooperative. But there are others who listen to me, but prefer to hear what their aunt had to say about their night guard and what the dentist who made the night guard said about wearing the device. And they know better for one reason or another, and they will not wear the device as directed. Therefore, they fall into the category of TMD patients who don't want to get better because they won't follow the protocol. And you try to be patient, and again, then how do you handle that? You go back, take a step backward, go back through explaining to the patient how it works, why it is different, why it is effective, exactly what you're doing with it and why it's important to use it consistently, especially at first, 24/7, to allow the inflammation within the temporomandibular joint to diminish or subside. But no matter how many times you say it, no matter how you address it, no matter how patient you are, there are a few, fortunately not many, but there are a few people who know better. Another variation of this is patients who wear it until they get better and then take it out. I'm glad I thought of that variation because this is actually more common. This is more common than, well, I don't want to wear it 24/7 because the lady who works next to me in the next cubicle, she didn't have to wear hers 24/7 or whatever. She just wore her night guard at night. That category is, patients who go through the protocol, have success. You get them up to 85, 95, 100% of their symptoms are diminished by their subjective statement or analysis. And then you go through the discharge, you do your final instructions and discharge the patient. And then they'll come back in, let's just say 2 years. I had one recently, 6 years. Came back 6 years and sat in my office and said, I'm having symptoms again. And my first thing is, well, have you been wearing your device? And to my surprise, the answer was no. And I said, well, do you still have the device? And she said, yes. You can draw your own conclusions, but this is actually more common than anything, is once the patients go through the process and they go through 24/7 for a while, then they go to nighttime and their symptoms diminish or gone, then for whether you want to call it being lazy or they think they don't have to, but they are instructed carefully that you are going to be in this device nighttime only, or when you sleep, nighttime when you sleep, or naps, indefinitely for the rest of your life, and patients won't do it. So therefore, I would categorize those as TMD patients who do not want to get better. They won't follow instructions. As you can see, most of this has to do with patient compliance. And patient compliance, as we well know as practitioners in any field, is one of the biggest stumbling blocks that we face as practitioners trying to get patients better, using any kind of treatment, device, surgery that has been devised or developed. that patients very frequently do not want to comply with what we know is the right method or the right protocol or the right series of things that they need to do to try to help us help them. So there's a lot of that going on. TMD patients who do not want to get better because they just get lazy, they think they're fixed, and they don't really remember, or they don't listen to, well, you're going to have to keep this thing in the rest of your mouth. And when you sleep, it's pretty easy. Just put it in at night, keep it clean with toothbrush and toothpaste, always keep it in the case. It'll be safe. You'll have it forever. The fifth category is a category that I've discussed clinically in detail prior, but it falls into this category again of TMD patients who do not want to get better, and just came across my plate this week, actually on Monday. This is Wednesday now, but on Monday is my day to see patients. And I had a patient that had the device for 3 weeks, and she came in, and I asked her how she's doing, what percentage of her initial symptoms are gone, reeled off the symptoms, and say, average those out. Tell me what percentage of those symptoms are now gone. And she said 0. And on top of that, it's getting worse. It's getting worse. My pain is getting worse. I wore it 24/7 for 2 weeks, and I haven't had it in for a week. It hurts so much. So I went through the usual, okay, that doesn't happen. That does not happen unless there's some kind of really unusual circumstance, which we're going to talk about in this case, or they're not wearing it, or the device is not set up correctly. Got to make sure the device is set up. There isn't any posterior occlusion. So I checked that. That was negative. Device was set up correctly, had good posterior disocclusion, good anterior even occlusion across the anterior 6. So as I'm talking with the patient, going through the litany of, well, why aren't we getting this out? And I thought about, we're only 3 weeks. I didn't feel that the vertical dimension needed to be increased at that time. She was getting more pain. And as I'm sitting there talking to her, I'm literally watching her do this, protruding the mandible. Now, that's not an intentional thing on her part. She was not aware she was doing that. But the point is, I brought it to her attention. You can imagine if someone in a device or out of a device for any reason is constantly protruding their mandible, they're disoccluding the condyle and the glenoid fossa. Just like if you have somebody pulling on your leg all night long, disoccluding the knee, how much your knee would hurt in the morning. Or if you did it during the day, how much it would hurt when you tried to eat, when for the prior 8 hours, you were just disoccluding the mandible, which is what one of the primary causes are for TMD, which is functional malocclusion, where the condyle does not seat in the centric relation and is constant pulling apart and putting together, mashing together. That's the primary cause of TMD. And so this particular lady was constantly doing this. All right, so I brought it to her attention. And again, in the prior episode I did on protrusive habits, usually what I do is I take a mirror and I show patients how they're protruding. I show them the difference between where they usually hold their mandible, which is forward, and then I bring them back, show them back where centric relation is, show them the difference. And I say, this is really a problem, and you're kind of working against us here. You're creating your own pain here. There's no way that this device is going to work when you keep on disoccluding, pulling out condylar head, the ball from the socket. And most people acknowledge that. They brighten up, they lighten up. Oh, I'm really sorry. Well, don't be sorry. You didn't mean to do that. And I understand it's kind of a habit with you. Habits are hard to break. And you really, just kind of pay attention. I think if we work together and you pay attention to not doing that, I said, we'll solve this problem. We'll keep you in the device. And if that calms down, I said, you'll get a good response. And seriously, almost all people brighten up, and they really try to do that. And almost all of them effectively get better when they quit protruding. That was the message of that episode that I did in the past. In this particular case, on Monday, I sat with this particular patient for at least 20 minutes, and I showed her in the mirror how she was protruding and why it was damaging the joint and why it's the device is not going to work if you keep pulling your mandible out of the socket. And her response was, I can't do that. I can't do that. She wasn't even aware she was doing it. And I kept my patient hat on, very patient, and I kept just reinforcing the fact of the mechanics of it. And basically, eventually she said, I'm not going to do that. I'm not going to try. I am not going to try not to do this all day long. That happened Monday. And that's what she said to me. I'm not going to try. So that patient falls into the category of TMD patients who do not want to get better. And that isn't the first time. I mean, I've talked about this protrusive habit. Almost all people want to try. They do try, and they are successful when they try. It's just a habitual thing, and they cut it out. But on Monday, recently, and that's what actually tripped this particular episode, the title of this episode. I said, I have to pull this together, pull all of these concepts together of examples and categories of examples of people who actually don't want to get better for one reason or another. And this particular patient, by my opinion, did not want to get better. She wasn't willing to at least try. I have to do that all day long. And the last category is a special category, and now we're out of this serious part of this. This is a humorous part. The other 5 categories I think were pretty serious because, the patients any patient in those first 5 categories can make you, the doctor, feel inadequate, wrong, that you're doing the wrong thing, or that you're not doing what you're supposed to do, which is actually try to help the people. Well, those people, some people you can't help because they don't want to get better. And I gave 5 categories of this. This last category is a little special because I have seen this relatively frequently. And to me, it's kind of humorous. It's not actually patients who don't want to get better. It's patients who are better, but don't want to they don't want to claim they're 100% better. And it goes kind of like this. You take the patient up through the protocol, whether it's 4 weeks into it, 8 weeks into it, 3 months into it, and they're brightening up, and they give you sequentially whatever percentage of the original symptoms are diminished or gone as you do your checks after you deliver the device. And you get them up to the point, and they'll come in and they will say, ask them what percentage of your symptoms are now diminished or gone, and they'll say 98% or 99%. And I heard that so many times, and I'd mark it down and I'd just go on. Okay, 99%, 98%, 99%. And finally, I heard that so many times, 98, 99. And I've got plenty of hundreds. There's no doubt that patients would come in, I'm 100%, I'm 100%. Well, that's good. And usually shortly thereafter, we would go through the final instructions and tell the patient, come back PRN. But I kept hearing these 98, 99 so many times. After a while, I just started pulling the string on it, asking a few extra questions. And I would say, okay, it's 99%. Well, 99% is gone. Yes, sir, it's 99% is gone. Well, what's the 1% that's still there? Oh, well, I'm worried that it might come back. I'm worried that it might come back is the last 1 or 2%. I laugh. I still laugh at that. Obviously, I find that humorous. I find it funny. Actually, anytime the patient tells me that, I laugh. I don't know. Hopefully I'm not offending them, but I think it's funny. And I say, Okay, you don't want to say it's 100%. No, I don't. It's like, it's just 99% because it might come back. But that is a testament, number one, to how effective it is what we do. First of all, I take it as a compliment. But there are a good number of people who just will not say 100%. They're going to give you 99%. 99% is it. That's as good as they're going to get. I'll accept that. I'll accept that, and I ask that question enough times that I know now why it is that they don't want to do that 100, that last percent, because they're worried it might come back. With that as the cherry on the topping here, I think I made my point. I hope I made my point. I hope this information is helpful to you as a provider, as a doctor, whether you are actually one of our network providers who I know are watching these episodes, or whether you're watching these episodes to learn from me and eventually become a provider to do the Urbanek device and protocol, which we know is extremely successful. Our track record is tremendous, and we have our study to prove it, and 5,000 consultations, 4,000 treated patients successfully. Some people will not get the device. I enjoy sharing this information with you. So for today, I look forward to the next time I'm able to speak with you. I appreciate those in attendance and those who take their time. I appreciate your time to view and listen to what I have to say. I really hope it's helpful. Those of you who'd like to join our network of doctors who successfully treat TMD non-surgically, you can discuss it with me further at tony@tmjservices.net. You can discuss it with our Director of Marketing and Education, Naomi@tmjservices.net. A plethora of information is now available on our website at www.tmjservices.net. So for today, I am Tony Urbanek. I look forward to our next episode. This is TMD Demystified.